It is a Wednesday, May the 6th. We're here with Dr. Teresa Frankovich for her media availability. We'll just jump right on in with the first question. Okay. Now that testing is more available, are all patients entering area hospitals being tested for COVID at entry?
So I would say no. There really is no recommendation to test everyone walking in the door of the hospital. That being said, the hospitals have really put in place safeguards, so they are, ensuring that their staff are masked when they're dealing with the public, so it provides a level of protection both ways. And of course, people entering the facility, unless they're unable to, should be masked as well. They're doing all of those sort of preparation, cleaning, all of those activities to keep the environment safe. And of course, right now, because we're at a low level of COVID activity, I really feel this is our window of opportunity for people to access some of the services they need to get for their complete health care that is not necessarily COVID related. And so when people think about some of their things like colorectal cancer screening, mammograms, some of their general maintenance for chronic conditions, all of those things, immunizations are very important. And I want people to know that the hospitals and our outpatient care settings have been working hard to be environments that are safe for them to come into, as safe as possible during this time. And again, we have a great window here for people to access some of those services while we are really just at low levels of transmission.
Okay. With the reopening of businesses, are we expecting to see a hospital surge as predicted by the CDH model that was presented at the discussion?
Well, what I would sort of emphasize again is that in that discussion we showed both worst case scenario and best case scenario in terms of surge, both if we kept everything in place and if we had nothing in place. So what we're trying to do with a sort of slow and thoughtful reopening is to thread that needle, to get basically to be able to navigate the space in between those curves so that we do not see that surge. That is in fact the worst case scenario. We will still have restrictions in place, a lot of public health measures that we've been talking about. So no, I don't expect to see that level of surge. And if we start to see trends indicating a concern for a high surge, that's when we're pulling back.
Non-essential Southern Humboldt retail businesses, the reporter says, are opening back up despite the order. Are they putting the public at risk? And just to give context, the reporter says the businesses are not curbside, they're allowing customers inside with PPE.
What I would say is that they're only essential businesses, as of today, are supposed to be operating, and there are very specific guidances for that operation. What the governor is talking about is with Friday, with his order, and again, we have not quite seen the language on that yet, is that businesses doing curbside or delivery, retail businesses will be able to operate. However, I want to remind people that that is contingent on that business being able to meet standards about operating safely. And so, yes, I would say that businesses who are not essential should not be operational today. And I do think that doing this in a not planned out and cautious manner is a risk.
A soft opening of the county is scheduled for Friday, according to the reporter. Can you share a sneak preview of what that looks like?
Well, again, we're waiting for the language from the governor about exactly what that is. What we're doing is we're anticipating that as of Friday, the governor has opened the door for retail businesses who do curbside and delivery to operate. However, again, they need to be able to do that safely, and so we want to know that these businesses who are doing so are able to ensure for their workers, and as they do curbside or delivery, that they're able to do social distancing, that they're looking at things like excluding workers who are ill, that they have hand washing, sanitizer, masking on site for all of their interactions. And so, it is not a direct, you're open. You need to have a plan.
And with plans to lift the shelter-in-place restrictions and reopen businesses in the coming weeks, what does this mean for the mandatory facial covering mandate? Will it be loosened, or will there be stricter enforcement?
Well, as we've been saying, one of the important pieces to lay the groundwork for easing shelter in place was to get masking in place for people to help make our environment safer as we begin to move around more. And so, no, there will be no easing of the masking at this time. And really, from my perspective, I see this as something that we can do for each other. Again, you can't recognize, looking at people, whether they're more or less vulnerable to this infection and serious consequences. I look at this as a way that we can help protect each other, and particularly those who are most vulnerable.
Absolutely. With the testing site at Redwood Acres, have you seen a large number of community members scheduling a test, or what has the response been so far?
Well, I understood there was a little problem with the online platform crashing, so it made me suspicious that we were getting a high volume on there, which is good. What happens is when we were scheduling appointments with our individuals, we were actually doing that in our own system, so we knew exactly how many people were scheduled. When we turn that over for general public scheduling, that's through the Optum individuals, we actually don't have access to that daily schedule right now. And so we have asked for that so that we can know in real time how many people per day are on there. While we're waiting for that, our indicator is as we start to see results coming back so that we know in fact how many people have been tested. So eventually we'll be able to give that information, but right now I would say it's a work in progress to get it on a same day basis.
Sure. Okay. And then county staff returning to county facilities was a topic at the Board of Supervisors meeting Tuesday, which was yesterday. In efforts to restore the economy, do you believe county departments should open up first?
Well, I think the point is well made that we need to be able to all think about how we can operate safely, and that we need to look at our interior organizations about what makes sense to be able to deliver services for the community, both from a retail business standpoint, from a governmental entity standpoint, for all of us really. So I'm really encouraging everyone to get out there and have their plan in place.
Sure. And then finally, First District Supervisor Rex Bone says that many people have contacted him wondering about reopening as far as baseball games, summer camps, those sort of outdoor activities and weddings and whatnot. What can you tell people who are anxious about getting back to normal, who are desperately looking for some answers?
I know, normal sounds like a really nice thing right now, but frankly, normal for me would be able to visit with a couple of friends. So we're going to be in a not quite normal phase for a very long time. And what I would say is I'm getting those questions too from individuals, and what we're trying to look at is, what can come first, what is going to come later. Some of our thoughts on that will be influenced by the governor and what we're hearing in the sort of guidance document that they're going to be providing this week. And some of that will be, taking that and tailoring it to our own community, as they've suggested we will be able to do. What I would tell you is that some of these large event types of things, where we're really gathering groups of people from all over, either for attendance at, say, a sporting event, or to bring them together to play on teams, those are things that are actually going to be a little bit later than earlier. Simply because as we bring larger groups of people together in close contact for a period of time, the risk increases. So I think we'll be talking a lot about this in the coming weeks and months, and keeping people apprised as we monitor where we are in the pandemic and know what is safe to do moving forward.
Great. Is there anything else you'd like to include today?
I think that's good. Thank you.